while pregnant women were grandly declared to be a vulnerable group, all the things that were needed to support women to socially distance and protect their health have just not been put in place. Maternity Action provides online information, telephone advice, we do some casework, and we've kept all of our resources up to date with the currently weekly changes in government guidance. A lot of the women who contact us are really quite distressed, very anxious, very worried. Some of them are in tears. Some of the big problems we're seeing are pregnant women being directed to work in public-facing roles. There's a long history of very poor health and safety for pregnant women, and you'd think there'd be some effort made to address this in such a terrible situation as we're facing now with the pandemic. But women have been left to just somehow try and find a solution with their employers. We've had a lot of calls from care workers. These are very badly paid roles, and you've got people in the nursing home who have COVID and others who may well have COVID and you simply don't know. And the woman's asked to be taken off the public-facing role, and the employers just said no. If you don't want to do that work, it's sick leave or it's unpaid leave, and in some cases it's disciplinary action. There's law that says that employers should do an individual risk assessment, look at their actual work, look at their journey to work and manage the risks, usually by offering them home working. And if they can't do that, then to suspend them on full pay or offer furlough. But we're just not seeing that happen in practice. And if you start looking for government guidance on this, you can't find it. And of course, if women choose not to work, they're told to go on sick pay or unpaid leave, which obviously is a huge financial cut at a time when they're very much in need of funds. But it also has impacts further down the track because your statutory maternity pay entitlements are dependent on your income during particular stages of your pregnancy. And if you're on statutory sick pay during that part of your pregnancy, then you won't be entitled to statutory maternity pay and you'll lose out on a considerable sum of money. The rates of maternity discrimination prior to the pandemic were already extremely high. 54,000 women each year across the UK who were forced out of their jobs because of maternity discrimination. And what that means when you come into a situation like COVID is you've got a lot of employers who are not well informed about what their obligations are in normal circumstances and are even less well able to negotiate the very difficult situation with COVID. If you're not a member of a union, now is a very good time to join your union. We're expecting there to be waves of redundancies after the COVID crisis lifts. I think furlough schemes helped defer that. We expect they will come through. And I think a lot of women are quite rightly fearful that they will be, first in the queue when those redundancies are made, because there is a long practice, well-established practice of unfair selection for redundancy amongst pregnant women and mothers, something the government could have addressed but hasn't. Even though the law is on the women's side, they're very, very hard for them to be able to create a negative consequence for those employers. No one's planned for this pandemic. No one's got their money prepared for several months off work. So the women are calling us quite distressed. There's a lot of women very, very distressed.